After having performed over 500 procedures with vaporization and enucleation with the Holmium 100-watt system, the Holmium Pulse 120 appears to me far superior in both procedures. If we talk about the duration of the procedure, I was very impressed with the new Pulse 120 system. I felt it was almost twice as fast. The enucleation itself was much quicker, maintaining the blanching and coagulation between the two planes. In addition to that, not only the blanching, but also when finding a bleeding larger vessel, I was able to change easily to a coagulation setting, which allowed me to stop even large bleeding vessels within seconds. This was an additional feature which we didn't have with the old system, which is very superior in the new system. The vision of Holmium laser has always been excellent in contrast to other laser systems. But now with the new system, the creation of bubbles is much reduced due to the higher hertz which can be used. I felt I had superior vision. Fibers of the detrusor muscle could be seen very easily. The capsule was very visible when approached, and therefore, again, we have a superior system here and much improved technology to help the surgeon. With the Pulse 120 vaporization system, I feel that surgeons who are concerned about the learning curve of enucleation may be very well served, providing the patient with an excellent procedure in a very safe learning environment. The new improved fiber Expedia, in contrast to Pulse, is revolutionizing the feature of vaporization with the new Pulse 120. The fiber itself handles much better. It is far more durable. Both fibers we used lasted the entire procedure, and the power transmitted with the fibers onto the tissue is excellent, providing a very fast vaporization of the tissue. After the procedures, all patients had entirely clear urine with no blood present. When assessing this new system, as a clinician, safety was paramount. Vision was almost perfect at any point of the procedure and superior to any other laser system I've experienced. Bleeding was almost non-existent. When bleeding was found, with all the features of the new Pulse 120 system, I was able to deal with this bleeding within seconds. And again, this was superior to all systems I experienced in the past. Because the laser does not penetrate into the depth, I felt always safe when addressing tissue, even in complicated areas. Overall, this system, for me as a clinician, is safe and can be used even by less experienced surgeons. The new vaporization system is clearly superior to KTP or TURPs. There is less bleeding, a better efficiency of removing tissue, and as we've experienced with our own patients, patients can have their catheter removed almost immediately and can go home the same day. This will improve the patient's journey greatly and their experience with this superior technique. Comparing the Pulse 120 vaporization to TURP, it is clearly superior in the lack of bleeding. The vaporization itself is comprehensive and creates a very wide cavity in the prostate and allows us to perform a complete procedure with full satisfaction. I can only recommend the Pulse 120 vaporization and enucleation system to colleagues who just embark on laser surgery, as well as surgeons who have already got experience in either. They will see that it will be superior in the procedure and in outcomes, and much easier to handle. I'm very enthusiastic about the new system, and I'm looking forward to use it myself in due course.